shortness of breath, palpitations, vomiting, dizziness, fatigue, unable to enjoy your friends and family due to that fatigue, decreased appetite, sometimes you don't eat for days, weight loss, unable to enjoy daily activities that you once enjoyed, depression. These are some of the symptoms that you experience with advanced congestive heart failure. Out of 6 million Americans, only 10% have advanced congestive heart failure. My husband Kelly is one of them. Congestive heart failure is where your heart muscles don't pump blood as they need to. Early on CHF can be treated with medications, healthy lifestyle of exercise, and a healthy diet. But as conditions worsen, the progress of the heart becomes weaker and it becomes tougher to treat. The American Heart Association has a classification. It's a system that grades the quality and severity of the failure. But this can change in less than one day. There are 4 stages. Stage 1, you have no limitations to your physical activity. Your daily activities do not cause undue symptoms. And then there's stage 2, slight limitations. You're comfortable while you're resting. Daily activities causes some palpitations, shortness of breath, and fatigue. Stage 3 has marked limitations. You're comfortable while you're resting still. And ordinary activities causes palpitations, shortness of breath, and fatigue. And then stage 4, unable to do physical activities without pain and discomfort. And then you have normal activities that causes, the symptoms, you stop symptoms while you're resting. And less than normal activities causes the same symptoms that I've mentioned just a minute ago. My husband's stage 4. Some of the causes of CHF can be developed if you've had other heart issues or if you had a heart attack. It also can be hereditary. My husband achieved both of these. He had a heart attack in 2011, and his mom passed away of congestive heart failure 11 years ago. The treatments include medications. My husband takes an average of 19 to 20 every day, sometimes even more if he has to take his nitro. And then there are devices, such as a valve replacement. And there are 2 different valve replacements. There's a pig valve, there's a mechanical valve. Both have pros and cons, so you have to choose what's best for you. My husband chose the mechanical valve. And then there's defibrillators. There are many different types of defibrillators. My husband has a defibrillator and pacemaker together. Doctor says it's the Cadillac of all defibrillators. And then there's a heart transplant. 90% of those who had heart transplants live past a year. And the number of recipients, however, are very low. Only about 2,500 people get to have a heart transplant in a year. Advanced CHF can be treated if early enough. There are other options out there for some of the CHF patients. And CHF, just remember, CHF is not always because someone had poor lifestyle choices. The life expectancy of a person with advanced CHF is not always known for sure. Even if a doctor gives you a timestamp, as they have my husband of 12 to 24 months, you continue to live life to the fullest. And in the words of my husband, you chew bubblegum, tap dance naked on the ceiling, and you fight till you can no longer fight. My advice, turn around and tell those who you love that you love them. Tell them this every day. Because as humans, we are not promised a tomorrow, so live as there will be no tomorrow. And most importantly, and I can't stress this enough, talk to them about your wishes. Tell them, have a plan of action when that day comes. It may not be the easiest conversation, It may be the most difficult and the most uncomfortable conversation you'll ever have in your life, but it is, however, the most important one. And think about organ donation. Based on the facts that I have presented to you today, it's obviously much needed, especially for someone like my husband. Thank you for your attention and support us with the position in front of you. You've been a great audience.